And Jim, of course, I don't know where you want to start this morning. You know, I mean, we should point out when we talk COVID, there is good news, which is the case counts are way down. Hospitalizations are down. Deaths lagging, unfortunately, and continue to be quite high. But there is a lot of concern about new variants. At the same time, vaccinations are picking up pace.
Look, I am very positive, and a lot of my information comes from Dr. Gottlieb, who's been very good about the rollout. He didn't use the word glut, but he did say that we're going to be hard-pressed to find more people beyond 100 million, literally in April, who have already taken it. And I think that what he's saying is a clarion call of we better find a new way, other than the algos that were talked about today in the Wall Street Journal, to get those vaccines to people once we have so many of them. So, David, look, I know we can say that it's going to be with us for a long time, but I get my flu shot every year. I keep thinking, why haven't they wiped out flu? But they haven't. I think it's going to be a form of flu from the very beginning, David, literally a year ago. You said that when we have therapeutics, when we have a mist, when we have something we can take care of ourselves, then this will become an illness, not a fatality. It's something that's killing millions of people. David, I think we're getting closer and closer to that, but we keep losing sight, eye on the prize. We keep talking about a vaccine. We need to talk about therapeutics.
No, you're right. It's funny because there was a period at which, as you know, I thought, and many others perhaps believed as well, you'd see the therapeutics prior to seeing the vaccines. But in fact, the vaccine moved along at rapid speed, and we're thankful for that. But those therapeutics will be there eventually, Jim. And to your point, as this stays in the background, as this mutates to some extent, those actually may end up still being a very important line of defense. Something that you can take if, in fact, you get it, if there is adequate testing around as well, which we all hope will be the case, that will just immediately stop the symptoms and or the progression of any disease. And so that will be really important, and that will allow us to be back to normal as well, even when we do get closer to herd immunity.
Shepard Smith here. Thanks for watching CNBC on YouTube.